Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Sorry it's been a long time since we've posted any new content for you. Please remember these videos aren't intended to replace visits to your regular physician. We're happy to see you here same day. If you're having problems, area code 775-359-7111. We really can't treat you over the internet or over the telephone. Today we want to talk about some really common breastfeeding issues for new parents, and that is the issue of breast milk supply and letdown. Run into this all the time with new moms, with moms with new babies, even moms on their third, fourth baby with a new baby, and there's some confusion and some difficulty that tends to occur. So the first thing to realize is that typically, mom's milk doesn't really come in large quantities until day 3 or day 4 of life, sometimes as late as 5 or 6 days of life. If this is something you're really struggling with, there are some things we can do to help you. Step number 1 is to make sure you put your baby to breast regularly, every 2 hours. If your baby's not available because they've been transferred to an ICU, or your baby's too sick or too weak to eat, and receiving medical care for that, then you can certainly use a breast pump. However, the reality is the human body was not designed to produce milk for a machine. It's designed to produce milk for a baby, and you will find that the stimulation from a baby is definitely much better than the stimulation from a machine. So pumping doesn't replace putting baby to breast if that's an option that's medically realistic for you. So that's step number 1, and it needs to be regularly. Once or twice a day isn't going to do it. It needs to be every 2 hours, around the clock. Number 2, there is an herb available over the counter that you can get at most health food stores called Fenugreek. It's F-E-N-U-G-R-E-E-K. Fenugreek is something we're all familiar with. It shows up in the diet. It's parts of the herb is used in salads, it's used in Persian cooking, it's used in Indian cooking. We've all had it. Anybody who's ever had artificial maple syrup, the nut is extracted to provide artificial maple flavor for artificial maple syrup, so Mrs. Buttersworth and all of those have extract of fenugreek in there. 2 capsules taken 4 times a day helps to enhance breast milk supply. There's something that's readily available called mother's milk tea, which is essentially a tea made from fenugreek. The downside to the tea is you got to drink a lot of it. And you need a bottle of water or hot water to steep it in, whereas the capsules you can throw in your purse and go. 2 capsules 4 times a day. When your milk does start to come in, you can start to back off on the fenugreek quantity, and some women can get off completely, others can't, and you just have to do some hit and miss and trial and error with that. The other thing that's used a lot is a medicine called Reglan, or metoclopramide. Reglan helps with breast milk letdown, but it doesn't really help with supply issues. So if you're engorged, if you have a lot of milk, but you can't get it to come out, then you'll find Reglan's very helpful. And you can get that prescribed from your doctor. There are some pediatricians who will prescribe it. A lot of OBs will prescribe it for you, and a lot of lactation consultants will prescribe it for you as well. The downside to Reglan is it can be a little sedating, and as a new mom, it's common you're already exhausted, so adding a sedative on top of that's not the most pleasant of experiences. It does help with breast milk letdown, however. But it won't bring in a supply if you don't really have milk. Stimulation and fenugreek help with the supply end. And then for breast milk letdown, there are some old home remedies, including small amounts of alcohol, assuming that's not against your religion. Getting intoxicated is definitely not a good idea. Small amounts of alcohol do help with breast milk letdown, but again, can be sedating, and when you're already exhausted, may not be a great idea. It can also alter the flavor of the breast milk. It doesn't make it toxic, but it does alter the flavor, and the babies notice that, and that may create some issues for you as well. And a lot of women just find in the immediate postpartum period, they don't tolerate it. They're too tired, their stomach's too upset from all the hormonal shifts, and alcohol is the last thing they want to put in their stomach, and I can't say that I blame them. But it is an option out there and worth a try. Small amounts. Again, the goal here is not to induce intoxication. I hope this short discussion's been enlightening for you and provided you some ideas. I really encourage people to try the Fenugreek. It is quite effective under many circumstances. That plus stimulation have been used by women for years and years to be able to induce lactation during directed adoptions. So when you know you're going to adopt the baby who's due in 3 months and you want to be able to nurse that baby, this is how we do it. Fenugreek 4 times, 2 capsules 4 times a day, and obviously you don't have a baby yet. Putting the baby to breast every 2 hours will often help to induce a breast milk supply so that when the baby is born, the adoptive mom can nurse that baby. If we can be of any assistance here in our office, our number is 359-7111. Remember, we cannot discuss this over the internet, but we'd be happy to see you here. We'll see you next time.